How to write mental assessment. Some of the information will be basic, such as the patient's age, gender, and ethnicity. Some information will be more telling in terms of what it reveals about the patient. Note the patient's substance abuse history. List all psychiatric drugs the client is currently taking. Include details that refer to the onset of the presenting problem, symptoms, previous treatments and providers. Recognize that every component of the patient's history is significant and will impact the patient's treatment, from the patient's chief complaint to the patient's family history. Look for nonverbal clues from the client such as an inability to make eye contact and nervousness. Observe and note the patient's hygiene, cleanliness, choice of clothing, behavior, mood and physical abnormalities. Note the patient's strengths and weaknesses. Does the patient seem willing to work on the presenting problems? Will the patient work with a support system in place? Does the patient have medical issues or financial problems that might prevent them from completing treatment? Examples of risk factors: suicidal, homicidal, homelessness, trauma, neglect, abuse, domestic violence. This will include thought content, obsessive, hallucinations, delusions, affect, mood and orientation. Your comments and descriptions will be required. Behavior: appropriate, inappropriate, and follow with a description of the behavior. Include a diagnosis for each axis. Axis I, primary presenting problem, such as major depressive disorder or bipolar disorder. Axis II, personality disorder, X, borderline personality disorder, or intellectual disability. Axis III, medical problems, only MDs can diagnose these. Axis IV, psychosocial and environmental problems. Axis V, global assessment of functioning, GAF, is a numerical rating on a scale of 0 to 100 of the client's current functioning with the life stressors he or she presents with. A GAF score of 91/100 means the patient is high functioning and easily managing the stressors in his or her life. A GAF score of 110 indicates that the patient is a danger to himself and or others. Ensure effective interventions by implementing a negotiations process between patient and mental health care provider.
Recommend treatment for the patient. Your recommendations should be based on your narrative summary and assessment. Your assessment should conclude with a statement about the patient's understanding of the course of treatment and its goals. This portion of the assessment shows that the patient is aware of the decided course of treatment and is willing to work with it.
Your treatment goals must be measurable with specific time frames for completion. Compile a list of treatment goals. Examples: reducing risk factors, decreasing functional impairment. Indicate planned preventions with patient participation. Examples would be anger management, parent training, problem solving. Patients report a better outcome to their treatment when they're in agreement with their practitioners about the course of treatment.
If you liked the video, subscribe to our channel for more awesome videos. Check the description below and thank you so much for watching.